Good morning. Welcome, welcome, welcome. I'm Marjorie Sims, and I'm Managing Director at Ascend at the Aspen Institute, and it's truly my honor to welcome you on behalf of the Ascend team. We're called Ascenders, by the way. And especially I want to welcome you on behalf of Ann Mosley, who is a Vice President of the Aspen Institute and also the Executive Director. Okay. That was Anne. But she's also the executive director and founder of Ascend. So, for those of you that are new to the Aspen Institute and Ascend, just please know that we are honored to host this convening. Convening is at the heart of our work. We believe bringing people together for the right conversation at the right time for action is critical. And that's at the founding of the Aspen Institute after World War II. So we do this often, and welcome to this particular conversation. We're honored to be doing this work in support of Dr. Beal. Clap for Dr. Beal. He's an Ascend Fellow and actually a real strong reflection of the Ascend Fellowship Program. So these are leaders who are working on large platforms or large ideas that really reflect their values, and they're working every single day to make certain that programs and policies are redesigned in a way that support the entire family. Our leaders know that, opportunity is not out there for everyone, but talent is. So we take a two-generation or a whole family approach to all of our work, and that means supporting both the child and the adult simultaneously. That's really our work to move systems and programs forward. So thank you for being here. I don't have more to say other than welcome. I know you're going to have a rigorous conversation and a great day, and I'll turn it over to Dr. Beers. Thank you.
This is the first in our series of Transforming Child and Family Mental Health in Washington, D.C. This is the beginning of a conversation. This will be the first in a series of conversations, and so we really hope and encourage all of you to continue to engage with us in conversation. I want to give a special thank you actually to the Alexander and Margaret Stewart Trust, and Lori Jackson is here on behalf of the Trust today, so thank you very much. The Stewart Trust has made both this summit today possible, but also made a very generous gift in January of this year to Children's National to create what we're calling the Community Mental Health Core. And CORE stands for Collaboration, Outreach, Research, and Equity. And our vision of the CORE is really to think about how do we transform how children and families receive mental health services across Washington, D.C., across the entire continuum, both from emotional health promotion and support for families starting at the earliest ages, prenatal, all the way through their lifespan, up through transition into adulthood. And so we're really excited, and one of the driving factors for this work is really thinking about recognizing there's so much good work happening across the city, but we don't all always work together and think innovatively together, and this is really a start of accelerating that work for us to be doing together. So we're really grateful for all of you being here today. As I said, as Marjorie discussed and as we've talked about, collaboration really is at the core of what we do. And in that spirit, that has really inspired how we've planned the summits. We know that there are really innovative things happening across the country, and we know that there are really innovative things happening here in DC. And so what our goal is to bring together the most innovative people from across the country with the most innovative people, all of you, from across our city, to really think about how we transform our mental health systems so that they do what children and families need them to do. So I think with that, I will actually pause and pass it over to our panel. I also really want to thank Aspen and Georgetown for co-sponsoring the series all together with us, and we really look forward to continuing conversation, and we look forward to continuing innovation together. So with that, I'm going to pass over to Matt and our panel and let him introduce our group. So